Now to a very special guest that's made time for us, Dr. Wafik Moustafa, who's a doctor from the NHS and who joins us now live from London. Thank you so much for making time between your patients, Doctor. Now, we hear so much about the pressure people such as you are, your colleagues working in hospitals. What is a typical day like for you, given the fact that so many of your colleagues have been away because of COVID?
Well, the NHS, National Health Services, overstretched, as you mentioned in your report, that the government have to co-opt part of the military and navy to help the staff, particularly with staff shortage. And Britain is under a really severe attack from Omicron, that more than 1 million people suffered Omicron positive or many admitted to those, many thousands. So I think it's a very dangerous variant. So it's not as dangerous as Delta, but spread faster. And hopefully the peak will go within the next few weeks. The fear if there's another variant come, but I think the British governments have taken it very seriously.
And how exactly will the military help?
Well, the military, the British military is quite well adapted for emergency situation, not just military operations, medical or fire, in forest, etc. They do work very hard. So there is about 2,000 military in UK co-opted in health services support, and as you mentioned, 200 in London alone, because there is many thousands of personnel, health personnel, doctors and nurses are in isolation, and you need to fill this gap. And I think the very important thing is to get vaccination program as fast as possible in Britain and in Europe and the world. And I think it's very important for people to take vaccination for COVID very seriously to limit this dangerous disease.
Absolutely, and that's an important message. And we hear that the NHS was already collapsing before COVID. What are red lines for the NHS and for people such as yourself, Doctor?
Well, we have to take care, we have to look after patients, we have to take care of ourselves, our staff. For example, I have 5 staff who tested positive over the last 8 months. So we are stretched all the time, but we try to work as much as possible to protect staff and serve the public, and as well to look, as you could see, waiting lists for routine surgery in hospitals have been delayed. And now the focus is to get people vaccinated and to treat any ill patients from COVID.
Dr. Wafik Moustafa, thank you so much for speaking to us today on TRT World, and good luck with the rest of your work and your day. Thank you.